We're joined now by the CEO of Direct Relief in the midst of what's been sort of a collaborative effort amongst many communities. And Thomas, we are really excited to talk to you today as we're in the midst of hurricane season. This one projected to be perhaps more intense than some. So what does that mean for our community? Are there any unexpected implications that people should prepare for because of this severe weather?
Well, I think it's a good question. I think we should just expect the worst, plan for the worst and hope for the best, because I think we're all on strong notice now. It's not whether the number is going to come up this year, if not this year, soon. And we've learned so much the hard way over the past, decade for sure. So at the individual level, we see the recurring crisis of people just having to evacuate rapidly, not having the medications that keep them functioning, and finding themselves in crisis when their manageable chronic conditions become unmanaged. So things like having a written down list of what your prescriptions are on a piece of paper, in a baggie that's waterproof, very basic and essential. So if you have to leave, you at least know how to keep yourself healthy. Really an evacuation plan, the basics that we all should have and many of us don't. But then looking at vulnerabilities, who in your household or your neighborhood is reliant on an oxygen concentrator or an infusion pump for home therapy or even a ventilator? I mean, it's great that these technologies can keep us functioning, but we're more vulnerable as we rely on them. So I think that personal, family, the concentric circles is always important. And groups like Direct Relief, privately funded groups, are looking how we can mobilize resources and help at the institutional level, because the governments are overwhelmed often after the emergencies. They cannot do it all on their own, and we can't expect them to. So we have to make ourselves as well prepared and less vulnerable to not become a victim as possible, and then plan as best we can against the known risks that are, increasingly well known because we go through them every year.
Sure. And I know you've had such an emphasis lately as you bring together folks from different communities and different health officials on collaboration and working together. Can you tell us a little bit about what Direct Relief is doing to make sure people are as prepared as they can be community-wide?
Right. I think as a support organization, we want to make sure, first of all, the governments got together. There were 14 governments, which, was extraordinary. They all came and they were talking about what they could learn from each other, kind of mutual aid from island to island. I mean, Puerto Rico is a big referral point for complex cases. So we went and looked at the pediatric hospital. It has a new infrastructure with an interventional radiology unit that's a resource for the Caribbean. But also just getting to know people. Some of these countries are small population areas and small geographies, which doesn't mean you have all of the problems. So I think just looking at how we can support each other, both government to government and private entity to public health institutions. Pan American Health Organization was here as well. So I think everyone's for collaboration. Sometimes it becomes a matter of who the lead person is. But I think we saw the First Lady of Jamaica and the delegation from Jamaica was here, could not have been more gracious and thankful, appreciative of what Puerto Rico was offering to extend to its neighbors, and very heartwarming for us to see. We just weren't sure if anyone was going to come if we had this convening, and deeply rewarding and kind of a sign of the times that 14 countries did and had a very strong sense of discussion. And we've committed to continuing that type of support to bring people together, and also having a pipeline of private support, because no government is really fully prepared for what can happen, and they need help from outside.
Thank you so much for bringing us this information and all of the hard work you're doing to keep everybody safe.